Thank you, Chairman. Thank you, witnesses, for being here. We've heard so much from Dr. Oz and Secretary Kennedy about their desire to curb chronic disease in America. And this committee is supportive of those goals to alleviate Americans' pain and suffering and relieve pressure on our healthcare system. While we can't legislate necessarily out of a chronic disease, this body can certainly evaluate the incentives or even the disincentives that prior Congresses have established on whether or not we can spur innovation and give Americans the tools they need to lead healthy lives. Dr. Taylor, dialysis sessions today are shorter and less frequent than when our parents or grandparents would have needed them, but it remains an extremely costly and draining treatment for kidney patients. 90% of all dialysis patients are Medicare beneficiaries. Medicare covers them regardless of age, yet Medicare reimburses dialysis providers at rates below the cost of providing care. Not uncommon, but still a bad formula. Mr. Taylor, where do you see areas for improvement in the ESRD bundle to better spur innovation?
Well, it is a great challenge. And as a not-for-profit, we don't have to answer to shareholders. And so we're able to make long-term decisions to give us a strategic advantage. However, reimbursement rates for Medicare patients can at times be below how much money we're spending to care for a patient. Additionally, the yearly updates may not be enough for us to make up the difference on a year-to-year basis. There has been a challenge with employing the appropriate staff, especially after COVID. And so we are competing with hospitals. We're competing with maybe the local Walmart, our patient care technicians. And so that is one of the challenges that we experience. If reimbursement isn't adequate for us to be competitive in the employment environment in a community, we will have the risk of losing and not being able to provide care. And so, I think for us, we're always going to try and find a way to provide care, but we have to do it in a sustainable manner. And if reimbursement doesn't exist or it's not adequate for us to keep a dialysis unit open, unfortunately, there are times when we have to close a unit. Our big concern is that rural communities are particularly at risk.
Yeah, makes sense. Thank you so much, Dr. Taylor. Dr. Watnick, ESRD care is the largest item on Medicare's receipt every year, over $50 billion. We spend 7 times per ESRD patient than we spend on the average Medicare beneficiary. We know it's expensive and we know it can decimate quality of life, but we do not screen at a meaningful rate to sort of get out in front of it. How can Congress better align incentives to incentivize education and early detection?
Yeah, thank you very much for your question, Congressman Warren. I would continue to emphasize that, first of all, there has to be education up front. So if you're talking about people who are coming for primary care appointments, we need to make sure that our community is partnering with primary care and giving incentives to make sure you're doing appropriate screening, including for people who already are seeing their providers. Some of them don't know to screen for kidney disease. So making sure that there's a campaign to educate that for people with chronic illness already, such as hypertension or diabetes, they should be screened. That is incredibly important. Also, we know that if you have patients already with chronic kidney disease, if you're providing education, you're more likely to have somebody to choose a best option for them, which both can improve their quality of life, improve their ability to contribute to the community, and may save money. For example, if they are able to get a kidney transplant before they even start dialysis, called a preemptive kidney transplant, that's optimal for their health, quality of life, and for the taxpayer. And also, if they're unable to get that transplant, if they do have access to all the therapies available, like home dialysis, that is also something that potentially can improve their quality of life and also is less expensive. So that kidney disease education benefit, passing that and making it more extensive, not just for stage 4, but for stage 3 and stage 5, so you can educate more patients, that would be another benefit. Thank you.
Thank you so much. Chairman, I yield back.